Good day, panelists. We are Group 2B from DSN3F, and today we'll be presenting you our research study entitled Knowledge and Practices of Community Parents Towards Malnutrition. For the objectives, the purpose of this study was to identify the knowledge and practices of community parents towards malnutrition. First, what is the demographic profile of the parent according to their age, educational attainment, family monthly income, nutritional status of the parent's child? Second, what is the level of knowledge of the parent related to malnutrition? Third, what is the level of practices of the parent related to malnutrition? Fourth, is there a significant difference in the knowledge and practices of the parents in relation to malnutrition when they are grouped according to their age, educational attainment, family monthly income, and nutritional status of the parent's child?
For the methods, for the research design, it is a quantitative research design and a descriptive approach. For the participants, we chose parents with 0 to 59 months old children identified as underweight or overweight residing in the chosen barangay. For our research instrument, it is a researcher-made survey questionnaire based on the following literature.
Table 1 shows participants' demographic profile, and in terms of age, most parents were aged 25 to 34 years old, with children that ages 0 to 59 months old, with that is 38.2%, followed by 15 to 24 years of age, with 31.6%, and lastly, parents with 35 to 49 years old that comprise 30.3%. In the highest level of education, most participants were high school undergraduate with 46.1%, followed by high school graduates with 36.8%, with the least being college level with 17.1%, indicating insufficient education among parents with young children. For the monthly income, most participants had incomes below 9,520 with 94.7%, with a few between 9,520 up to 19,040 with a percentage of 3.9%, and some between 19,040 up to 38,080 with a percentage of 1.3, indicating many were near the poverty line. And lastly, for the nutritional status of the participant's child, most participants with 81.6% had underweight children, while some with 18.4% had overweight children, indicating a prevalence of undernourished children unable to meet their nutritional needs. Table 2 presented the participants' knowledge regarding malnutrition, with the overall result that showed that parents were knowledgeable with a mean of 4.3. The age group of 25 to 34 had the highest mean of 4.37, followed by 35 to 49 with a mean level of 4.26, and 15 to 24 with a mean level of 4.25, indicating good knowledge across age groups. Participants with a high school graduate level had the highest mean knowledge of 4.35, while high school undergraduates followed with a mean of 4.29, and college-level undergraduates had the lowest mean of 4.21. Although not statistically significant, still, the result shows that all parents were knowledgeable about malnutrition. Participants with an income of 19,040 to 38,080 had the highest mean knowledge of 4.75. Those with incomes less than 9,520 followed with a mean of 4.29, and 9,520 up to 19,040 had the lowest mean of 4.25. This suggests that high-income parents were highly knowledgeable, while others were also knowledgeable about malnutrition. Participants with underweight children had the highest mean knowledge of 4.38, while those with overweight children had the lowest mean of 3.96. This suggests all parents were knowledgeable about malnutrition regardless of their child's status.
For Table 3 age of the participants, for all three age ranges, results shows that they are competent. For age range of 15 to 24 years old, which is 4.14%, and for 25 to 34 years old, which is 4.3%, and for the 35 to 49 years old shows 4.21. For the highest level of education, all of the three variables results shows that they are competent. For high school undergraduate shows 4.21%, for high school graduate shows 4.31%, and for college level undergraduate shows 4.6%. For the monthly family income, ranges of 90,040 pesos to 38,080 pesos with results of 4.75% shows that they are skilled, while for family monthly income of less than 9,520 with results of 4.22% show that they are competent, and for 9,520 to 19,040 pesos with results of 4.25% shows that they are also competent. For the nutritional status of the participant's child, for underweight with the results of 4.38% shows that they are competent. For the underweight, with the results of 3.53%, shows that they are competent.
So for the table 4, the level of knowledge of the participant when they are grouped according to age. So for the 15 to 24 years old, the median is 4.25. 25 to 34 years old, the median is 4.37. And 35 to 49 years old, the median is 4.26. And this interpretation means that the
participants are knowledgeable.
For the highest educational attainment of the participants, all of the three variables, which are the high school undergraduate, high school graduate, college level undergraduate, with the results of 4.25%, shows that they are all knowledgeable.
Table 6 shows that the participants were knowledgeable in terms of malnutrition based on the mean value of 4.25 and 4.5, while those with the highest income are highly knowledgeable. Moreover, there was no statistically significant difference in the level of knowledge of the participants on malnutrition when they were grouped according to the monthly income of the parents. Therefore, regardless of the monthly income, the knowledge regarding malnutrition do not differ.
For Table 7 reveals a statistically significant difference in parents' knowledge of malnutrition based on their children's nutritional status. This indicates varying levels of knowledge among parents based on their children's nutritional status.
So for the Table 8, the difference in the practices of participants in relation to malnutrition when grouped according to age, for the ages grouped 15 to 24, 25 to 34, and 35 to 49, all medians are 4.25. This interpretation means it's not significant.
Table 9 shows that the median values of each variables were all the same, and that there were no statistically significant difference in the level of knowledge of the participants on malnutrition when they're grouped according to the highest educational attainment. Therefore, regardless of the educational attainment of the parent of the child, the practices of the parents to malnutrition do not. Table 10 shows that all parents with 0 to 59 months old children identified either as underweight or overweight were competent and skilled. Moreover, there were no statistically significant difference in the level of practices on malnutrition of the participants when they're grouped according to the monthly income of the parents. Therefore, regardless of the monthly income of the parents, the practices of the parents' malnutrition do not differ.
Table 11 shows that parents with underweight children had a higher median value of 4.25, while those with overweight children had a lower median of 3.5. The Kruskal-Wallis test found a significant difference in parents' practices in relation to malnutrition based on children's nutritional status. Despite this, participants remain competent. Despite the parents being knowledgeable and competent, children may remain malnourished due to factors beyond parental control. These factors include environmental constraints, cultural influences, time limitations, and restricted access to nutritious foods. Effective prevention and management of childhood malnutrition require early intervention strategies that consider the complex interplay of social, cultural, and physical contexts.
So for our recommendation, a multifaceted approach to address this issue was recommended: implementation of community-based health education, improving access for nutritious food, establishing home gardens within these areas, and conducting comprehensive surveys.